Governor says expanding testing and contact tracing, those will be big parts of reopening this economy while making sure Ohioans stay safe. News 5's Olivia Fecto with us live right now. Olivia, local health leaders say it's good this is a slow reopening of Ohio's economy.
Yeah, good evening, Rob. One doctor says that Ohio doesn't have the infrastructure to do this much contact tracing. But health leaders agree that contact tracing is the best way to lower the possibility of a spike in new cases.
Contact tracing is critical to move forward.
Dr. Daniel Simon is the president of University Hospital's Cleveland Medical Center. When it comes to contact tracing for COVID-19, Dr. Simon says he's following a recommendation from former CDC director Dr. Tom Frieden to keep the virus boxed in.
Test, find, isolate, and quarantine as really the basis for moving forward before we have a vaccine.
The Ohio Department of Health handles contact tracing for the general public, while UH does it for its own healthcare workers. The process takes time.
You're asking an individual, tell me all the people in the last 48 hours that you've been within 6 feet for more than 5 minutes.
But health leaders say the work is important, and so is expanding testing.
We're hoping that there isn't this huge spike.
Donna Skoda is the health commissioner of Summit County Public Health. She's pleased the governor has ordered a slow reopening of the economy and a chance for more workers to be trained in contact tracing.
That slowing down of not having everything open right away will give us an opportunity to train some individuals.
But a professor of medicine at Case Western Reserve University says Ohio would have trouble managing a potential surge in cases right now.
I think it's a very careful, slow, thoughtful plan that's going to minimize the risk of having a surge in infections in Ohio. But I think it would have been better to wait until a little bit later in the month until we got the number of cases under control.
He says with Ohio seeing about 300 new cases a day, if each person interacted with 10 others, more than 42,000 would need to be traced. Dr. Simon believes there will be an uptick in cases as the economy reopens.
The question is, can it be controlled?
Both Skoda and Simon say that they are looking to countries like Singapore and South Korea that were able to keep down the spread of the virus by using contact tracing as well as expanding testing. They're hopeful that that will help manage the spread of the virus here. Rob.
Olivia, I know New York State Governor Cuomo says that he needs an army. So here in Ohio, what does Ohio need for all of this contact tracing? How many people?
Well, the governor said today it could be up to 1,750. Right now, there is a smaller number of workers who are doing that kind of work, as well as some volunteers. So obviously, many more would need to be trained.